Megan Taves. Megan is a lecturer at the University of Adelaide Law School, and she teaches tort law, medical law, and ethics and evidence. And her research interests include examining the legal and ethical issues associated with genetics and genomics, organ donation and transplantation, rare diseases, and biomedical research. So prior to joining the University of Adelaide Law School, which she arrived there just in January, Megan worked as a research associate and senior and sessional instructor at the Health Law Institute in the Faculty of Law at the University of Alberta, where she held a prestigious James Krepner Fellowship awarded by Canadian Blood Services for her project looking at the legal strategies to increase organ donation in Canada. Megan was also an instrumental member of our CNTRP Core 1, which is our ethics, economic, legal, and social platform in the CNTRP. And Megan has led several really important CNTRP projects looking at the issues of family veto and consent and incentives and opt-out. And so a reminder, so Megan recently published a fast fact on all the issues surrounding opt-out in Canada. And I would encourage you to check it out. It's on our website, cntrp.ca/fastfact. And we have a collection. We have about 10 fast facts that we've put on there right now. And I'm just about to post the translated versions in French. But they cover different topics in anything to do with donation and transplantation, just trying to give you all the facts around one particular topic. So the most recent one we did was on opt-out, but we also have one on public solicitation. We have some on living donation. We have some on the ethics of donation and transplantation. So I encourage you to give those a look. Okay. So at this point, a final reminder, please mute your computer speakers and mute your line during the presentation. And it's my privilege to turn it over to Megan.
Thanks, David. Thank you for that introduction, and thanks everyone for signing on to the webinar. As David mentioned, opt-out consent, also referred to as presumed consent, is a very hot topic right now, especially in Canada, and so I'm really happy to share my own thoughts and insights on this topic with you. So a brief overview of what I'm hoping to accomplish today. I'm going to start by looking at what is opt-out consent for those who might not be as familiar with the topic. I'm going to talk about or address why we're actually talking about this. Why am I presenting on this? What are some of the arguments in favor of switching to opt-out consent? What are some of the potential concerns? And all of this is going to be discussed within the context of looking at whether this is actually a good idea or not for Canada. So what is opt-out consent and how does it differ from our current consent framework? Well, currently in Canada, we operate under an opt-in or an explicit consent framework. This is an example of legislation from Alberta. Other provinces and territories have very similar legislation. And we can see here that a consent that's given under the legislation authorizes the removal and use of the specified organ for the specified purpose. So what this means is that there's no legal authority by the government, by the transplant teams, by the organ donation organizations to procure anybody's organs unless an explicit consent has been given. And that can be given by an individual or the individual's authorized surrogate decision maker. So the legal default currently in Canada is that organs cannot legally be procured. They cannot be taken from anyone unless there is an explicit authorization or an explicit consent to give the legal authority to do that. Under an opt-out or presumed consent system, everyone is essentially deemed to have consented to organ donation unless they have explicitly opted out at some point during their lifetime. So it's a different legal default here. Here, the legal default is that authority actually does exist to proceed with procurement for everybody, and it's only if an individual has actually indicated through the proper channels during their lifetime that they don't want to donate, that authority is extinguished. So why are we talking about opt-out consent? Why does presumed consent seem to come up a lot in Canada? Well, I'm sure it's no surprise to anyone on this webinar that in Canada right now we are not meeting the need for transplantable organs. The number of organs that are being donated isn't meeting the needs of patients on transplant wait lists. We have thousands of Canadians on wait lists and hundreds of Canadians that die while waiting every year. And so we need to be creative, we need to be open-minded and think creatively about the type of solutions, the type of strategies that we should incorporate to try and address this gap. So the underlying rationale for opt-out consent is that we can see that 95% of Canadians approve in principle of organ donation. 95% of Canadians think that this is a good thing. But when asked whether they have actually made their own personal decision to donate, that number drops drastically. And this survey indicates that only 51% of people had actually decided that they themselves want to be an organ donor when they die. And of that number, an even smaller fraction has indicated that they've actually taken steps to register their consent. To register their consent to be an organ donor. And so the rationale behind opt-out consent is that this big, massive group of people that is in favor of organ donation in principle, but hasn't quite got around to either making up their own mind or registering their consent, that this group of people might be better captured as potential donors under an opt-out consent system. And this rationale has really caught on in different jurisdictions in Canada at different times. A couple years ago, a health minister in Nova Scotia had indicated that presumed consent might be an option there. That didn't really end up going anywhere. But more recently, it's been raised in Manitoba last year by a patient group that now has been taken up by a politician in that province. And additionally, the Premier of Saskatchewan has indicated that Saskatchewan might be looking to switch to presumed consent, also very recently. So it's a very topical issue right now. And the idea here, the rationale why this is catching on, is because it's being seen as a potential option to increase donation rates in these provinces. So there are a number of jurisdictions that have made a change or that have implemented opt-out consent frameworks around the world. A lot of them are in Europe. There's also some in Central and South America. A recent addition to this list is the Netherlands, as well as Wales, which we'll come back to in just a moment. The big question is, what impact has opt-out consent had in these jurisdictions? Has opt-out consent itself really increased donation rates in all of these places? So this is a chart. I can appreciate the typing on this is very small, but this compares donation rates between countries around the world. And so all of the little blue bars with the orange arrows on top of them, those are countries that have some sort of opt-out or presumed consent legislation. So you can see at the very top of the graph here, we have Spain, who's really a world leader in organ donation rates. They have a presumed consent law. We have the US there, which is an explicit consent jurisdiction like Canada. And despite not having presumed consent, they have relatively high organ donation rates. And if you were to break that into individual states within the US, there are some states like California that have donation rates that are very, very high, that might even rival Spain's. For reference, there's Canada. We're kind of middle of the pack. So what we can see here is that there are some countries with higher donation rates that have opt-out legislation, but there are also some countries on the other end of the graph with opt-out legislation that haven't had this sort of transformative effect of presumed consent. And we also have explicit consent jurisdictions that also can have relatively high donation rates without presumed consent. And so this raises questions about what other factors might be involved here to explain some of this variation. And what impact does the opt-out consent itself actually have? So I thought to try and address this question, or to discuss this question, it would be worth looking a little bit more in detail about the Spanish model. And this is because Spain really is a world leader in donation, and it's also because it seems almost impossible to have a conversation about opt-out consent or presumed consent where Spain doesn't come up in some way, shape, or form. Everybody loves to bring Spain into this discussion, and so I thought that it would be worth addressing in a little bit more detail. So Spain is known as being a world leader in organ donation, and there's a number of factors, a number of things that Spain has done to try and increase its donation rates. So they have donation or transplant coordinators that are stationed at every procurement hospital. They have invested a massive amount of resources into organ donation. These things include ICU beds, personnel, operating facilities, to allow for more donor identification, even at some of their smaller hospitals. They've also invested a lot in education of patients, the public, healthcare workers, and also a lot of training for some of these people. The way that their fee structures are structured actually incentivizes hospitals and some of their personnel to increase donation rates. They also have a standardized process for quality assessment and evaluation of the donation process. And they've also fostered a really positive relationship with their local media. And this has really fostered very positive attitudes toward donation in the media and in the general public. And in addition to all of these things, they have legislation that embodies a presumed consent model. So all these different factors raise the question about whether it's actually the presumed consent legislation, or is it all these other factors that's driving Spain's donation rates, or is it some combination thereof? And so I think it's worth drilling down into the Spanish model a little bit more to look specifically at presumed consent and how it fits in this landscape. So Spain first introduced its opt-out legislation back in 1979, but there wasn't an immediate significant increase in donation. It really wasn't until 10 years later when the government made a massive investment of resources, time, training, etc., into their donation system, and they actually restructured their donation system, that Spain became a world leader in its organ donation rates. And so it wasn't the introduction of presumed consent per se that led to this increase in rates. And if we actually look at how presumed consent operates, there's some reason to doubt whether Spain truly operates like a presumed consent or opt-out consent country. And this is because significantly, Spain doesn't even have any sort of opt-out registry for its citizens. So if you live in Spain and you want to opt out of becoming an organ donor, there's actually no way for you to make your wishes known. And that's because they actually require consent by families in order for donation to happen. So even though they have presumed consent legislation, an explicit consent by your family is going to be required in order for you to become an organ donor. They also haven't invested a whole lot of time or energy into educating the public about opt-out consent specifically, or about an opt-out process, because there isn't really an opt-out process for people. So Spain in practice is certainly not kind of a hardline opt-out country, and yet it still has one of the highest donation rates in the world. So what impact does presumed consent have? We just looked at Spain as an illustration, but there have actually been a number of studies that have tried to get at this question. And I won't go through them all in detail, but they're here. If you log onto the webinar later, you can look these up yourself. And they've come to different conclusions. The evidence is somewhat mixed. We have a systematic review that have looked at a number of these studies, and they concluded that when you try and control for some of these other factors that might be involved, that the evidence suggests that there's an association between increased donation rates and presumed consent. However, they concluded that even though there's an association, it can't be inferred that the introduction of presumed consent legislation per se will lead to an increase in donation rates. And they mention all these other factors that could be at play. A different way, or other commentators have also questioned whether presumed consent is an indicator of a country's commitment to donation rather than a direct cause of high donation rates. So based on the evidence, it's still a little bit unclear. It seems that there's an association between presumed consent and high donation rates, but whether that's actually the direct cause of that is not entirely clear. And it's also worth noting that there are a number of different ways of structuring an opt-out consent system. So most opt-out countries have some sort of mechanism that would actually allow people in that country to opt out if they want to. As I mentioned, this is noticeably absent in Spain and a few other opt-out countries as well. Some presumed consent or opt-out countries also maintain a parallel mechanism or registry that allow people who really want to be a donor to indicate that as well. And so we see this is how Wales introduced presumed consent at the end of 2015. There are two registries where you can register either you really want to be an organ donor or you really want to opt out. And all of these structures raise the question about what role should families play when it comes to deciding about organ donation for their loved one. How does a family's opinion fit in to a presumed consent system? So there was a fantastic study that was done a few years ago that looked at this question in the context of both presumed consent and explicit consent countries. And what they found was that of the 25 presumed consent countries that they looked at, 21 of them actually allowed families to object to donation and to prevent donation from occurring. And this was done in different ways. In Sweden, if the wishes of the deceased person were not known, then the families actually had a legal right to object, and they had to be informed of that right. In Belgium, Finland, Singapore, and Sweden, the legislation did not allow families to override an individual's expressed wishes to donate. So if the individual made or met the requirements for consent to donation, then the families couldn't override that. But if the individual's wishes were not known, then the family's wishes at the end of the day were still respected even there. So we can sort of understand consent for organ donation as being sort of a continuum. So if we put explicit consent or opt-in consent on one end of the spectrum and presumed consent, opt-out consent on the other, We could see that our current system, we require either individual or family consent. So that would be on the left side of the spectrum. But within the umbrella or under the umbrella of presumed consent or opt-out, there are different ways that we've just seen that this system can be structured. So sometimes systems of presumed consent that still allow families to object are referred to as kind of a soft opt-out. Where a more hard opt-out system would be one where if you have not opted out during your lifetime and your organs can potentially be donated, then they will be donated regardless of what your family wants. So if we were to consider restructuring our framework to implement opt-out consent in Canada, what would that actually look like? As I mentioned, right now we are here. We are on the explicit consent, opt-in consent side of the spectrum. So should we move down the spectrum? And if so, how far? And I think it's worth asking because oftentimes it seems just with talking with people about this issue, I think a lot of people envision sort of a more hard opt-out system. When you think about presumed consent, when you think about opt-out, I think that the image or the framework that comes to mind is one where if you don't opt out and you can donate, you will donate. But I think it's worth considering whether that type of hard opt-out system would actually work in Canada. And in my humble opinion, I think the answer is a big fat whopping no. I really don't think that a hard opt-out system would actually be feasible in Canada. And the reason for this is because right now, and if anyone's seen my family veto presentations, this slide might look familiar. I'm not going to go through in any detail, but this shows different policies of organ donation organizations and governments across the country. And right now, if an individual gives consent to be an organ donor, in most places that's a legally binding decision. But despite what the legislation says, we know as a matter of policy and as a matter of practice that if a family objects to donation, it's not going to happen. That families are effectively deferred to when it comes to the decision about whether to donate an individual's organs. So in my mind, if right now we're not willing to procure organs in the face of family opposition, in a situation where we know that the individual wanted to donate because they consented to donate, and when that decision is actually a legally binding one, I think it's very difficult to imagine a situation where there would be a willingness to do so if we're simply just presuming that the individual wouldn't have objected, if there lacks that explicit consent for donation. And so in my mind, a soft opt-out system is really the furthest down the spectrum I think that we could realistically go. So this begs the question about how would a soft opt-out system actually differ from our current system? Because as we just saw under our current system of individual or family consent, families are really deferred to at the end of the day. And similarly, in a soft opt-out system, even though there would be the legal authority to proceed with donation, if the family objects, the family's wishes would be deferred to. So the same result would happen regardless of whether we stick with an explicit consent or if we move to a soft opt-out. So the question, and I think really the crux of presumed consent in Canada, is the issue of whether changing the legal default about authority for donation, would this actually make a difference in family decision-making? Would this actually lead to more families consenting to donate? And so here I think it's worth taking a minute to look at the situation in Wales. Wales is a common law jurisdiction, much like Canada. It has a lot of similarities to Canada, more so than some of the other civil law countries that have implemented presumed consent. And Wales implemented a soft opt-out system at the end of 2015. And so it's been operational for just over a year now. And the goal there was to increase family consent rates and overall donation rates. So how is Wales doing? If you look at the media headlines and the news headlines, you would see that the system, the presumed consent is showing promising results. It's encouraging. It's been embraced by the public. You would probably have a very positive indication about how things are going there. Seems to be successful. But I wanted to look at what the actual data says. And so I found this chart on the NHS website that compares donation rates in Wales since 2012, and it's done by fiscal year. And so we know that their opt-out consent was implemented in December of 2015. So in the fiscal year 2015-2016, actually most of that year was prior to the opt-out system. Only about the last 4 or 5 months of this column would have been applicable to the post opt-out system. So it's really this last column that it captures a time period that was entirely within their presumed consent system. Now this column only has data for the first 3 quarters of this fiscal year. But it's worth looking at the total number of deceased donors. So we can see in the 2015-2016 year, there was an increase. There were 4 more donors than there were the year before. Now, in the last column, that is admittedly only for the first 3 quarters, it shows that there were 39 total deceased donors. So if we were to do the math and extrapolate this, that would mean that they are essentially on track to have a total of 52 deceased donors for that fiscal year. Which, if you can see and compare that to the other years, that's actually a bit of a decline from the 2015-2016 year, and it goes all the way back to their 2012-2013 year. And so I don't want to infer too much from this. This doesn't actually show family consent rates. The data is also preliminary. I think that we really need to wait and see what impact presumed consent is going to have on Wales. But I think that this data at least creates or should create in us a moment to pause and question whether presumed consent has actually had or is actually having some sort of significant positive impact on their donation rates, because certainly in the first year it doesn't look like that is the case. And it's also worth considering how many people are opting out. So we can see here that about 6% of the Welsh population has joined the opt-out registry. They don't want to be considered potential organ donors. I don't know if this is a very significant number or not. Maybe it is, maybe it's not. But I think it's also worth questioning whether this group of people is objecting to organ donation in principle, or if their objection is more to the opt-out system. So I think it's important, or it will be important for us to keep an eye on Wales and see what's happening there and how this actually bears out. So would opt-out consent be a good idea for Canada? Well, on the potential benefit side, it might lead to higher donation rates. It might not. I don't think this is a given. If you take nothing else away from this presentation, I hope you take that it's not a slam dunk. It's not necessarily going to be the case that our donation rates skyrocket if we change the default of our consent. But if there's a chance that it could increase our donation rates, it's worth talking about, it's worth considering. But we also have to be mindful of some of the potential concerns that could be raised with this type of consent framework. Specifically, I think we need to be mindful of issues of public trust. Our organ donation system only functions to the extent that the public accepts and trusts it and buys into it. And if that trust is undermined in any way, that could be very damaging. We also have to consider whether there is sufficient support in the medical and the donation communities, because these are the people on the front lines that are going to have to be actually implementing any sort of change in policy or legislation. And finally, I think we need to consider whether this is really the best use of resources. Resources for donation and transplantation are somewhat limited, and is this really where we should be investing our time and money? So to break some of these down a little bit further, I thought it was worth asking the question or looking at, what does the public actually think about presumed consent? So this is some Canada-wide survey data from Canadian Blood Services that compares public opinion from 2001 to 2010. And we can see an increase in support between that time period from 50% to 54%. Now this data is somewhat outdated. 2010 was a while ago now. I know that there has been some more recent Canada-wide polling. I looked on Canadian Blood Services website and I don't think it's actually been published yet, but from talking to some of my colleagues, my understanding is that the current data shows a much more significant level of support, somewhere in the 60% range. And so it does seem to be moving in a very positive direction, with some significant increase there. It's also worth considering how support for presumed consent varies across the country. My understanding is that the highest support is in Quebec and Atlantic Canada. The CNTRP did a public survey within Alberta a couple years ago, and what we found there was that about 62.5% of Albertans either supported or strongly supported presumed consent, with about 18% being neutral and 20% opposing it. So a relatively high level of support, but we can't ignore the 20% that are opposed to it. And it's also worth noting that there are inherent limitations when it comes to survey data. And when it comes to presumed consent and actually changing the legal default for our consent, it would also be absolutely crucial to consult with marginalized and vulnerable populations, and to make sure that any sort of opt-out system, that everybody is made aware of it, and that the actual ability to opt out is made accessible to everyone. What are some of the underlying concerns about presumed consent? I think there's probably room for more research here. Off the top of my head, I think that there are some serious concerns about autonomy. In Canada, we have moved very strongly from a system of more paternalistic medicine to one of patient involvement in medical decision making. Our ability to control what we do with our bodies has been enshrined in court decisions, which have found that this is actually part of our constitutional and charter protected right to security of the person. We have a very, very, very strong respect for patient autonomy in Canada, more so than probably most countries in the world. And so there are questions about whether switching to presumed consent might actually undermine this autonomy and whether there would be some backlash to that. There's also some sort of big brother-ish concerns about whether this is going too far, giving the government the authority to take our organs. There's also some concerns that moving to presumed consent might actually undermine the altruistic notion of donation, that we see this as being a gift of life. We see our donors as a hero. And if people aren't actually making that as a voluntary, explicit decision, some people might view that as undermining sort of the altruistic nature. There are also some persistent myths about donation and transplantation. We can see here in this picture that, transplant teams are sometimes viewed as being these sort of vultures that are circling the body wrongly. It's a myth about organ donation, but it's one that continues to persist. And there's a potential that presumed consent could actually exacerbate these views. So what are the consequences of enacting presumed consent without sufficient public support. And here we can look at Brazil as an example. So Brazil had an opt-in system. They had an explicit consent system like ours. In 1997, they moved to an opt-out system. But there wasn't very strong support by doctors and the medical community. They didn't really have the infrastructure to support a very robust donation and transplantation system. And there was a lot of public fear about organs being removed prior to people actually being clinically dead. And as a result of this lack of support, there was an enormous backlash to this law, and less than 2 years later, they had to switch back to an opt-in system. So it's also worth considering what healthcare providers, what professionals in organ donation and transplantation fields actually think about presumed consent, because as I mentioned, these are the people that are really going to have to be implementing this type of a consent system. So 2006 data showed about 60% or 59% somewhat or strongly supported presumed consent, and this was a survey of health professionals. A 2011 survey of donation and transplant professionals found, again, sort of a modest level of support, 55% support for presumed consent, and 31, about a third of the respondents were opposed to it. So it'd be worth really exploring with this group, specifically of the people who are opposed to it, what some of their concerns are, and whether those can actually be addressed. So finally, would investing in an opt-out consent system be an efficient use of resources? Well, I think here the answer is maybe. There's a chance that moving to opt-out consent could have a positive impact on our donation rates, which would be fantastic. It's also worth considering what some of the costs would be. There would have to be extensive consultation with the public and education efforts to make sure everyone's aware. In Wales, they spent 2 years prior to launching their presumed consent system really engaging with the public to let them know, which increased a lot of awareness about organ donation more broadly. There would have to be an investment in the infrastructure to actually support a presumed consent system. There would have to be a registry created and maintained. There would have to be an ability to actually check that registry at the relevant time. And there would have to be retraining of organ donation and transplantation professionals about how presumed consent is actually going to operate in practice. How does this change the conversation that we're going to be having with families? So this might be something we want to explore, but I think it's also worth keeping in mind that this isn't the only option. This isn't the only strategy on the table for increasing donation rates. Not all places in Canada have a DCD program. That might be somewhere to focus efforts. We can see in Ontario, they've implemented donation physicians at different hospitals, which seems to have had a positive impact. My understanding is that BC is emulating a similar model. In the fall, the CNTRP and Canadian Blood Services held a workshop looking at donor identification and referral, and looking at how can we be better at actually identifying potential organ donors in hospital, and how do we make sure that we're actually communicating with the appropriate organ donation organizations about these potential donors. There's been a lot of effort by Canadian Blood Services looking at effective requesting. If the best we can really hope for out of a soft opt-out system is increased family consent rates, maybe it's worth putting more effort looking into how are those conversations currently happening? How do they happen in other countries, presumed consent or otherwise, that have high donation rates? And finally, not all jurisdictions in Canada have a registry for people to even indicate they want to be an organ donor. And so maybe that would be a good first step before we jump right to presumed consent. So to conclude, would opt-out consent be worth trying in Canada? I think maybe if you had the right combination of enough public support, if there's the political will to actually take the initiative to proceed with changing legislation, if there was the resources to accompany that to make sure that it's done properly with appropriate public consultation and research. And finally, if it was done in a jurisdiction that really had a somewhat advanced or established donation infrastructure, because there are some things presumed consent can't do. It's not going to create a DCD program. It's not going to necessarily lead to better donor identification and referral. So if you had a jurisdiction that was already implementing some of those other factors, maybe that would be a jurisdiction that would be worth trying presumed consent in. In the meantime, I think we need to continue researching this option. We need to continue talking about it. We need to continue monitoring public opinion. And I think it's worth really continuing to monitor and observe the situation in Wales to see if this is going to be a success or not. But it also would be worth keeping our immediate focus and attention on some of these other efforts, some of these other factors to increase our donation rates. So thank you all very much. That's all I have for you today on this topic. Happy to take some questions.
Thank you so much, Megan. That was an excellent presentation and an excellent overview of the situation. Participants, please feel free to type your questions into the chat box. Those that are on mute on the phone, if you'd like to ask a question on the phone, just unmute yourself by pressing star 6. And Megan. And there would be just a slight delay. You just heard an echo from my own self there. There's a slight delay because of Megan's in Australia right now, so we'll just have to be patient when we're listening to questions and answers. Mm-hmm. We have multiple people typing. Okay, the first question here from Lindsay McKay. Thank you for a great presentation. Isn't opt-out used in Spain for UDCD? There wouldn't be a time to get family consent, I don't think.
I think that's...
There wouldn't be a time to get family consent, I don't think.
So that would be uncontrolled DCD, I believe. I'm honestly not sure how that would work. I don't think I know enough about the uncontrolled DCD process. I would think that some sort of family consent would be needed, maybe not to start the process. I think you're right that there wouldn't be time to get consent to do some of the initial work that would need to be done to allow for an uncontrolled DCD, but my instinct would tell me some sort of family consent would be necessary at some point, but I'm honestly not entirely sure how that process breaks down. Worth looking into, though. I will look at that. Good question.
Okay. Another question from Joanna. Joanna from CF Canada. Our community is becoming more vocal about opt-out consent advocacy because of the dire need to increase donation rates. Clearly, we need to educate them about the realities of opt-out. This webinar would be really valuable to educate our community. My question is how we can all best work together in Canada to increase donation rates. I'd love for us to collaborate and voice a unified message to make change happen soon.
Yeah, I think that's a really good point. I think venues like the CNTRP are good for that kind of a thing because it is Canada-wide. But I know that there are a range of different views out there on this topic, different views from different organizations even that relate to organ donation and transplantation, and so So I think it is difficult, and it is a controversial topic, and I think that there is room for differing opinions, but I think you're right that there needs to be some more conversation. I know CNTRP and CBS, Canadian Blood Services, have been trying to align on this topic. But I think you're absolutely right that there needs to be more education, more talking about the different facts and realities of this topic.
And we have a comment here from Sylvain. I think this is our Sylvain from Core 4, one of our patient partners, just asking sort of the general community. Have we considered giving more coaching at medical trainings and nursing, considering that in 7 to 10 years, they only talk about organ donation 8 hours in their program? That's something maybe to take away for those that are also participating on this call. Megan, do you want to comment on that at all?
I would be in favor, definitely, of increasing the amount of time devoted to organ donation and transplantation in medical school or nursing school. I honestly don't know what the current training is like, but it seems like there might be some room, if that's true, if it's only 8 hours in the program, to increase that.
We have a comment here from Boris. Opt-out consent applies to all types of donors in Spain. Uncontrolled DCDs require both family and judicial consent. Both are contained within a 90-minute period. Great presentation, Megan.
Thanks, Boris. That clarifies that.
Oh, another one from Megan, or from Esme here. Hi, Megan. Thanks for this wonderful presentation. In the Netherlands, they recently changed their system to opt-out. This hasn't had the effect they hoped for, though, so far. During Donor Week, more than 80% registered as a no. Of the 6,500 registrations that were changed, more than 60% of the people changed their yes to a no. Do you see something like this happening in Canada if they change to an opt-out system? Sorry if you've addressed this already. Okay.
So I hadn't actually heard. I knew that the Netherlands had recently changed to opt-out. I hadn't heard about the 80% registering as a no. That is very, very shocking. And I think that really illustrates the need to engage the public to make sure that there is enough public support for this type of system, to make sure the public understands what this system means, what the implications of this system would be for them. I think that would be absolutely crucial before taking such a drastic step. And I think that that's especially so in Canada because we do have such a strong respect here for individual patient autonomy. It'll be really interesting to see what the impact of that is in the Netherlands if they're able to maintain a presumed consent system with 80% of people registering no. That's very, very large.
I'll let people read that themselves. I have a few more comments coming in. Also, there's another question about the cost. Do we have any cost calculations about how much it would cost to put an opt-out system in our country?
That's an excellent question because I think that's also a very important factor to consider. If you only have X amount of dollars to invest in organ donation and transplantation, is this the best use of money? And I don't have an answer to that, and I honestly don't know if there have been any actual estimations about how much it would cost. But we would need to actually implement some sort of register to allow people to opt out. That might be more easily done in a province that already has a register that allows people to opt in. But then also, yeah, education of the public, training, all of that, it's all going to take time and money.
Well, thank you very much, Megan, for this excellent presentation, and thanks to our participants for joining as well. Just a reminder that we have got some other upcoming presentations, and I'll leave that with you on the screen. If you'd like to join any of these webinars, just contact David or Karen, and their contact information is there. Thanks again, Megan, for joining us all the way from Australia. Thanks again, Megan, for joining us all the way from Australia.
Thanks for having me, Steph and David, and thanks everyone for listening. Thanks.
Take care, everyone. Thanks so much. Take care.